Hey, this is Dr. Davis. Let's talk about graded exposure. If you have low back pain, knee pain, shoulder pain, whatever kind of pain or injury, one of the things that's very natural is for you to become fearful of particular movements because they hurt. Maybe your knees hurt when you bend them, so you start to avoid squatting down to pick things up or squatting down to sit in a chair. Maybe your shoulder hurts when you push on stuff, so you avoid pushing open doors with the arm that hurts. Or you stop doing push-ups because they hurt too much. Or maybe your low back hurts when you round it forward. So you start walking around like you got a stick up your butt every time you hinge forward to pick something up because you're afraid to round your back. Well, it's a terrible thing to live in fear. So with graded exposure, we can slowly start to expose the body to the thing that you're a little nervous about, the thing that your body is a little sensitive towards, and ease our way back into normal activity. It's a really fast and easy way to get people back to normal activity. I use this with patients in clinic all the time. Now, the key with patients is they need to be patient. Sometimes we need to start slow and we need to do something kind of easy for longer than we want to. And then we can slowly add a little bit of intensity, a little bit of intensity, a little bit of intensity, until we can finally do the things that we really wanted to do in the first place. So if your shoulder hurts and you can't do any push-ups because they hurt too much, break this pushing movement down a little bit. First, just make sure you have general range of motion. And if you don't, then work on controlled articular rotations or just basically circles with the arms every day. Just make sure you have your full range of motion. And then once that feels not painful, do something harder. Maybe work on a bottoms up kettlebell carry for stability of the shoulder. This is a good way to start to engage the muscles while working on stability without pissing it off. Maybe after doing that for a week, try something harder. How about a single arm banded press or a cable press? Really lightweight, very little resistance, just enough to start to work this pushing motion, and maybe this doesn't hurt. Do this until it doesn't hurt, or really until it just gets boring. It's just too easy and you gotta move on. Don't skip steps. Be patient. If you jump to too difficult an activity too quickly, that's when you lead to chronic pain. That's when you lead to bad outcomes. You keep injuring it, you keep irritating it. Be patient. But if you take it step by step, eventually you can really load up those arms and get back to some heavy lifting or push-ups or bench presses or whatever you wanted to do in the first place. So just remember, the key part of graded exposure is that it is graded slowly. As a general rule, I recommend adding about 10% intensity per week, no more than that. So if you were doing sets of 10 push-ups, for example, then the next week maybe you do sets of 11 push-ups. If you were bench pressing 100 pounds, maybe next week try 110 pounds. But don't go from 100 pounds to 150 pounds. It's a big jump and your body might not respond well to that. Take it slow. We could use the same logic for knee pain. So as an example, let's say that it hurts to bend your knees. So maybe a squat hurts too much, but you might be able to just work on general range of motion. If this knee hurts, maybe I can just straighten it, fire up those quads, and then bend the knee and gently hug. And I can just work on this for a handful of days, or maybe it's weeks, maybe it's months, I don't know. But if you just get this range of motion to calm down, then you can progress. You can start to ease yourself back into squats by doing really, really baby squats. Box squats are a great option here. Squat to a certain depth and do this on a regular basis for maybe a week or two. Then move the box a little bit lower and get down and try this for a couple weeks. You can keep moving the box a little bit lower and lower as you can tolerate. If you don't have a box, maybe get an office chair that lifts and lowers and just squat until this depth, and then lower it down and squat to a lower depth and get used to that. And of course, eventually you'll be able to get some weight on that knee and really load it up. So the most difficult thing really is just to have patience, to take it one step at a time. Don't add more than 10% per week. And if you want somebody to write your program for you for exercise and rehabilitation, I can do that. I work with patients online and I write their programs all the time. So reach out to me and go to my website if you want to work with me. Thanks for watching. If you have questions, leave them in the comments and I'll see you in the next video.